I'm Dr. Jeff, an advanced trained non-surgical disc specialist, a chiropractor, and a candidate for the Fellow of Primary Spine Care. Today, we're going to be talking about spondylolithesis. It's a big word. It's the new buzz right now because of the United Healthcare CEO who was gunned down by this supposed gentleman here. And the supposed gentleman had spondylolithesis and back pain, and it's buzz in the news. So I want to teach you what it is, whether it can be helped surgically, non-surgically, what's an emergency, and then I'm going to share with you a picture that's going to blow your mind. So let's talk about what it is. Spondylolithesis means there is a fracture of the spinal bone. This is the front of the spine here. Here's the back of the spine here. And there would either be one of two things: a fracture here and here, which would cause this part of the front of the bone to pull forward away from this part. That's called a lytic or break. Or the fact that the spine's been out of alignment for so long, you're putting lots of pressure on this bone where it doesn't belong, and then the bones elongate. This part of the bone right here would elongate, called the pedicle, on both sides, and cause this part, the body, to slide forward. So spondylolithesis is either due to trauma and lytic, or it's degenerative. Either way, it is when this part of the bone right here, called the body, slides away from the bottom. It slides forward either from a fracture or degeneration. And it's broken down into 4 grades. Grade 1 is where this bone and this bone should line up, where the top bone slides 25% of the bottom bone forward. Grade 2 is 50%, so here is the back, and this is the vertebrae sliding forward on the base of the tail called the sacrum, 50%. This one is 75%, and this one is 100% slid forward. Grade 1, Grade 2, and Grade 3 can be handled non-surgically. We work with these every single week on our practice. You align the spine, we work on repairing the disc, and we build core muscle strength in Grade 1, 2, and even 3. Grade 4 is emergency surgery. Go to the surgeon right now, don't wait. If this comes off, you can see paralysis in the lower part of the body. So when we take x-rays of all of our new patients, if we see Grade 1, 2, or 3, and it's stable, then we can help it. If it is a Grade 4, it goes right to the surgeon. We don't pass go, it just goes to the surgeon. Now I'm sharing with you this picture right here. If you look at this picture, this is what I call a Grade 5. Now there's no such thing as Grade 5, but this patient walked into our office 2 weeks ago. 15-year-old kid walks into the office with this. I call it a Grade 5 spondylolithesis. If you look here, the bone is actually laying in front of the other bone. He could be paralyzed if he was adjusted by a chiropractor without x-rays who didn't know what they were doing. As a matter of fact, this patient came from Pennsylvania 8 hours away to come see us for a second opinion. His thought was, we saw a surgeon, can you help us? We are helping so many people from across the country that our second opinions are people who go to the surgeons now first and come to us because we're experts in what we do non-surgically in the spine. And we've helped him serious cases. He wanted to know, can you help this? And the answer is absolutely not. We saw this. He drove 8 hours from Pennsylvania. We saw it right away and said, you need to go back to your surgeon and have surgery. Grade 1, 2, and 3 can be helped chiropractically and by building core muscle strength and very specific chiropractic that we do in our office. Grade 4 goes to the surgeon right away. I'm Dr. Jeff from the Midwest Disc Clinic, Legacy Chiropractic in Northeast Indiana. I'm an advanced trained non-surgical disc specialist and chiropractic veteran of 23 years. I'm also a fellow for the primary spine candidate for primary spine care fellowship. I'm Dr. Jeff. Have a great day.